Most people believe that if a doctor recommends surgery, the decision is simple. The specialist has years of training. The hospital has advanced technology. The paperwork is already waiting. All you have to do is say yes. But after decades of watching older patients go through major operations, I've learned something that many people never hear until it's too late. The greatest risk is not always the disease. Sometimes it's the recovery. I've seen patients walk into the hospital independently and leave needing assistance for everyday tasks. I've seen procedures that were technically successful, but came at a much higher cost than anyone expected. And that's why today's discussion is so important. If you're over 60, there are certain surgeries that deserve far more careful consideration than most people realize. Before we begin, let me be absolutely clear. This is not a video against surgery. Modern surgery saves lives every day. The goal of this video is something different. It's to help you ask better questions before making one of the biggest health decisions of your life. Because the older we get, the more important those questions become. Think about it this way. If you take two houses and put them through the same storm, the newer structure may barely notice it. But an older building with years of wear and tear may experience damage from the exact same event. The human body works similarly. As we age, recovery becomes more demanding. The heart works harder. The lungs recover more slowly. The kidneys process medications less efficiently. And the brain can take longer to return to normal after anesthesia. Many people are surprised to learn that some older adults experience weeks or even months of confusion, memory problems, or mental fog after major operations. Doctors refer to this as postoperative cognitive decline. Not everyone experiences it, but the risk increases with age. And that's why understanding your personal risk profile matters so much. Now, let's talk about the first surgery, open heart surgery. For the right patient, bypass surgery can be life-saving. There's no question about that. But for someone in their late 70s or 80s who already has kidney disease, diabetes, or other chronic health problems, the situation becomes more complicated. Open heart surgery places enormous stress on the body. The heart is temporarily stopped. A machine takes over circulation. Inflammation increases throughout the body. Recovery can be long and demanding. Today, many patients may also qualify for less invasive procedures that don't require opening the chest. That's why one simple question could be life-changing. Ask your doctor, is there a less invasive option available for someone like me? You may be surprised by the answer. The second surgery is aggressive spinal surgery. Back pain is one of the most common reasons older adults seek medical care, and understandably so. Chronic pain affects quality of life. It affects sleep. It affects mobility. But here's something many people don't realize. For certain age-related spine conditions, extensive surgery doesn't always provide better long-term results than conservative treatments. Physical therapy, targeted injections, strength training, weight management. For some patients, these approaches may provide similar benefits with significantly lower risk. That doesn't mean surgery is never necessary. Sometimes it absolutely is. But it does mean every patient deserves a full discussion of all available options. Third on our list is major cancer surgery. When people hear the word cancer, the natural reaction is immediate. Remove it. Get it out. As quickly as possible. And emotionally, that reaction makes perfect sense. But medicine is rarely that simple. The goal isn't just removing a tumor. The goal is preserving both life expectancy and quality of life. In some older patients with multiple health conditions, extremely aggressive cancer surgery may create risks that deserve careful discussion. That's why one of the most important questions you can ask is, what will my quality of life likely look like after treatment? Not just survival, quality of life. Both matter. The fourth procedure is elective joint replacement in medically fragile patients. Hip and knee replacements have transformed millions of lives. Many patients regain independence, mobility, and freedom from pain. But timing matters. Preparation matters. Overall health matters. A patient with well-controlled blood pressure, healthy blood sugar levels, and strong cardiovascular health often recovers very differently from someone whose health conditions are poorly controlled. That's why many specialists now recommend prehabilitation, improving strength, nutrition, and overall fitness before surgery. The better condition your body is in beforehand, the better it can handle recovery afterward. And finally, Emergency abdominal surgery. Unlike the other procedures we've discussed, this isn't usually a choice. Emergencies happen suddenly. But there is something important every family should know. Older adults often face significantly greater risks during emergency operations compared to planned procedures, which is why paying attention to warning signs matters. Persistent abdominal pain, changes in bowel habits, unexplained bloating, unexpected weight loss. These symptoms deserve medical attention sooner rather than later, because prevention is always easier than emergency intervention. Before any major surgery, I encourage every person over 60 to ask 4 questions. First, what happens if I don't have this surgery? Second, are there less invasive alternatives? Third, what does recovery realistically look like for someone my age and health condition? And fourth, what are the most common complications patients like me experience? These questions don't make you a difficult patient. They make you an informed patient, and informed patients often make better decisions. Here's the most important message I want you to remember today. A surgical recommendation is not a final verdict. It's the beginning of a conversation. You deserve time. You deserve answers. You deserve to understand every available option before making a decision. Because the best medical decision isn't always the most aggressive one. Sometimes it's the one that aligns best with your health, your goals, and the life you want to continue living. Take care of yourself. Stay informed. And never be afraid to ask questions about your own health. Those questions may be more powerful than you realize.